So, ayun. Hi, class. Good morning. Okay, so I'll be your lecturer again for this week's lecture topic, which is arterial puncture. So, we're done, okay, if I'm not mistaken, discussing, okay, with you about your venipuncture and your skin puncture or your capillary puncture. Okay, so in the laboratory, we have three methods of blood collection, namely your venipuncture, skin puncture or capillary puncture, and your arterial puncture. So of all those three methods, kindly take note that the most commonly used in the laboratory is, of course, your venipuncture. Okay, so why not arterial puncture? Why it is not, okay, commonly used in the laboratory? Same thing with your capillary puncture. Okay, of course, those three methods of blood collection has their own advantage and disadvantages in performing that in the laboratory. Okay? When it comes to arterial puncture, since this is our topic, your arterial puncture is actually technically difficult and at the same time, potentially more painful and hazardous than your veni or your skin puncture or the capillary puncture. Also, okay, arterial specimen are not normally used in routine blood tests, though composition of arterial blood is more consistent throughout the body as to compare that with the venous blood. Okay? So, with all those disadvantages I've mentioned to you about your arterial puncture, why we need to perform, okay, arterial puncture in the laboratory or in the hospital, or you might ask, so why collect arterial blood if it is not routinely used in the laboratory and at the same time, it's more painful and procedure is technically difficult during performance, okay? So the primary reason why we need to obtain arterial blood is for that so-called arterial blood gas test or arterial blood gas analysis, also known as your ABGA. Okay? So if you are a fan of K-dramas, okay, lalo na yung Doctor Romantic, tsaka yung mga ibang K-drama wherein the story evolves sa mga hospital setting, so maririnig nyo na yung mga ABGA na yan or the arterial blood gas analysis, okay? Which is commonly requested to assess or to evaluate respiratory function of an individual, okay? But take note that during capillary blood, okay, in case of ABG or in case of capillary puncture during capillary puncture discussion, in case of ABG, okay, capillary blood, which is similar to arterial blood in composition, provided that the site is warmed prior to specimen collection, is sometimes used, okay, for ABGA instead of the arterial blood in case of infants. Okay, so if you remember, okay, that in case of capillary puncture, when you warm the site before blood collection, okay, of that blood sample by performing capillary puncture, we call that as arterialized, okay, capillary blood. And that is used then again for ABG, okay, analysis in case of infants. Okay? So, pwede rin yun, possible din yun. But in case of adult, madalas, instead of performing or getting that arterialized capillary blood, we perform your arterial puncture. Okay? So, in this lecture, what we're going to discuss, class, will be mainly about the advantage and disadvantage of different arterial puncture sites, because we have also many available sites to use for performing your arterial puncture. Radial ABG procedure. Radial, that is one artery or one site to use for your ABG or arterial blood collection, ABG analytes, okay? And of course, arterial puncture hazards, complication, sampling errors that could arise, and specimen rejection criteria. In addition to that, principles of arterial puncture is of course will be discussed also during this lecture. Okay? So yung haba po na yun, umpisa pa lang or overview pa lang ng ating lecture. So let's now start with our lecture. So what is arterial puncture? Of course, from the word itself, you are puncturing the artery to collect blood. And the blood that is obtained or withdrawn comes from a patient's artery. Of course, obviously. Okay? So the blood sample is collected without tourniquet, just like your capillary puncture, but unlike your venipuncture, wherein you need to use a tourniquet to obstruct venous blood and at the same time to make the veins more prominent. This time, when it comes to arterial puncture, tourniquet is not needed for blood collection. Okay? So again, the primary reason or the main reason why we need to obtain arterial blood by performing arterial puncture is of course then again for the so-called blood gas analysis or mass complete arterial blood gas analysis or ABGA or arterial blood gas test. Okay, so later I'll be discussing what are these parameters included in this arterial blood gas analysis. So for you to determine na ito palang parameter na to is ginagamit for ABG wherein we use, okay, our arterial blood as the sample for testing. Okay, so the arterial blood is characterized for being an oxygenated blood with a bright red color. So in here, we have here a picture to show you the difference between an arterial blood and a venous blood. So take note that these two blood is different. Okay? Bukod doon sa pinagkuhaan sa kanila, okay? The content of the venous blood is somewhat different from your arterial blood. So the arterial blood is characteristically bright red in color, such as this one. Whereas for the venous blood, okay, this is, of course, described as having a dark red color. So as you can see here in the picture, bright red is arterial blood and dark red is your venous blood. Okay, so just in case you are performing venipuncture and you make use of the basilic vein as the site of collection for venipuncture, but you accidentally hit, okay, the brachial artery. So one thing that indicate there is of course the color of the blood that you're going to collect. Pag iyon yung ginamit mong site, na instead of getting dark red blood as your sample, you get a bright red color. Therefore, that indicates that that is an arterial blood but not a venous blood. Okay? So what's commonly used, okay, or routinely used for blood testing, okay, or those parameters, analyte measurement, okay, in the laboratory is venous blood rather than your arterial blood. So dito tatandaan nyo lang na kaya lang tayo nag-arterial puncture, it's because of this purpose. Okay, because of this test. Your arterial blood gas test or your arterial blood gas analysis. Okay? So, arterial puncture is performed by whom? Okay? So, take note class. Here in the Philippines, we medical technologists are not allowed to perform arterial puncture. So, ang nakakagawa lang po niyan dito sa Pilipinas is of course, okay, the doctors or the physicians and RTs, okay, or the respiratory therapies. But according to our reference book, okay, MD or doctor can perform arterial puncture. Also, same thing with our nurses, As medical technologists and technicians, respiratory therapists, emergency medical technicians, and that so-called level 2 phlebotomist. Okay? In performing arterial puncture, which is true for nurses, medtechs, RTs, okay, medical technicians, and level 2 phlebotomists, okay, they must have an extensive training involving the theory, okay, the demonstration of the technique, observation of the actual procedure, and performance of the arterial puncture with supervision before they can perform arterial puncture on their own. Meaning, you should undergo first extensive training before you can be allowed to collect blood coming from an artery or to perform arterial puncture. Pero dito sa atin sa Pilipinas, kahit yung mga physician, okay, or itong mga artist na sinasabi natin, kahit wala silang extensive training, they're allowed, okay, to collect blood. Pero siguro hindi lang din natin alam, but they undergo training before they can do that, okay, on their own. Siguro sa una, they'll allow them to perform that, but with supervision of those, okay, who had undergone extensive training about the theories and, of course, the procedure of arterial puncture. Okay? So, individuals to perform arterial puncture must undergo periodic evaluation. So, it's not as simple as having the degree of being a medtech and then you pass the board exam and then you're allowed to arterial puncture performance. No. Okay? So individuals to perform arterial puncture again must undergo that so-called periodic evaluation. So if they do not meet the standards, they must have a remedial instruction and then be reevaluated before allowed to collect arterial specimen independently. So it's not as simple as getting the degree, passing the board exam, and then you'll be able now to collect arterial blood through arterial puncture. Okay? Hindi po ganun. Pagkatapos mo pang mag-extensive training, okay, kailangan ka munang ma-evaluate. Pag hindi ka pumasa dun sa standard, kailangan mong ulit magkaroon ng kind of like review or remedial instruction. So hanggat hindi ka nakakapasa dun sa evaluation, you cannot, okay, or you are not allowed to perform arterial puncture independently. Okay? So take note of that. So after those, okay, who can perform arterial puncture, next question here, class, is what are the sites for arterial puncture? Okay, so sites for arterial puncture includes the radial artery, and of all the sites, this is the commonly used, okay, in performing arterial puncture. Brachial artery is another artery of choice. Femoral artery, scalp artery, and umbilical artery. Scalp artery and umbilical artery are other sites to use in case of infants as our patient. Okay? And other site to use for adult patient, if your brachial, radial, and femoral is not available, is your dorsalis, pedis, arteries. Okay? So later we'll be discussing one by one this site on what's the advantage or what's the disadvantage of using that site in performing your arterial puncture. But as of now, just kindly take note that these are the sites for arterial puncture. Usual is radial, brachial, and femoral. For infants, other sites to use include scalp and umbilical artery, and in adults, other sites to use includes or dorsalis, pedis, arteries. Okay? So, speaking of the site, what are the site selection criteria? Meaning, class, when do we choose the brachial artery over than the radial, since I've mentioned that the radial is always be the first choice? Or why use femoral instead of the brachial and the radial artery? Okay, so site selection criteria includes number one, there should be presence of collateral circulation. So this is considered as the primary site selection criteria, meaning sa lahat ng criteria na ito, ang una mong titignan if there is presence of collateral circulation. Okay? When you say collateral circulation, the blood supply is coming from more than one artery. So hindi lang yung artery na tutusukin mo yung pwedeng mag-supply ng blood doon sa maaapektuhan na parte ng katawan. Okay? Iyon yung tinatawag natin na presence or collateral circulation. So, this presence of collateral circulation can be evaluated either by performing that so-called modified Allen's test that we're going to discuss later, or by using, okay, a portable instrument or ultrasound instrument wherein, of course, here in the Philippines, as we all know, baka wala pa tayong ma-encounter na tinatawag na portable ultrasound instrument to check if there is, of course, collateral circulation. So madalas, ang ginagawa natin is that modified Allen's test. Pero syempre, hindi ko naman minamaliit ang Pilipinas. Meron sigurong ibang ospital na meron doon. But do not expect na lahat ng ospital makaka-encounter kayo niyan. Okay? When they perform or when the physicians perform this arterial puncture. Next site selection criteria is if the artery, is accessible and the size. Take note there, cause that the more the accessible the artery, of course, the better. And the larger the size, the better also, para hindi ka mahirapan mag-puncture, ng artery mo later on. Next site selection criteria is the type of tissue surrounding puncture site. Okay? There should be low risk of injuring adjacent structures or tissue during the puncture. Okay? The ability to fix or secure artery to prevent rolling. And then if there's adequate pressure can be applied to artery after collection. Okay? So those are the 3 site selection criteria that we must consider when it comes to this type of tissue surrounding the puncture site. Okay? And the last site selection criteria is that there should be absence of inflammation, irritation, edema, hematoma, lesion, wound, AV shunt in close proximity, or recent arterial puncture. So you should prevent on choosing that site, as your site for arterial puncture if there's presence of this, Kasi nga, one of the site selection criteria is that this inflammation, irritation, etc. should be absent, from your side. Okay, so the caution on the last criteria of site selection is that never select a site, in a limb with AV shunt or fistula. So AV shunt or arteriovenous fistula is common in patient undergoing dialysis. Pag merong mga kidney disorder or kidney failure, nag-undergo na yan ng dialysis. So pag they undergo dialysis, that a site, or the site in the limb with that so-called AV shunt or fistula should not be selected. Okay? Yung artery na malapit doon, kailangan parang ilaan na natin yun doon sa fistula ng patient kasi kailangan yun. Kasi when it comes to arteriovenous fistula, pag duduktungin, yung artery and vein ng patient, so mixture of venous and arterial blood is now circulating, or is now present on that so-called fistula. So you should be careful not to select a site, in close proximity with that AV shunt or with that AV fistula. Okay? So those are the different site selection criteria. And now, let's proceed on discussing the advantages and disadvantages of choosing this site over this site. And let's start with your radial artery. Okay, so I mentioned earlier that your radial artery is the first choice and the most commonly used site for performing arterial puncture. Okay, So why is it the first choice or the most commonly used site? What are the advantages of choosing this site over your femoral and over your brachial? So the advantage of choosing this site is that it has a good collateral circulation. Okay, the radial and ulnar arteries can supply blood going to your hands, but you cannot use ulnar artery as the site for arterial puncture. Okay, it's easy to palpate since this is close to surface of the skin. So by using your middle finger and your index, okay, idiin mo lang doon sa may wrist where the radial artery is present, makakapa mo na siya or mararamdaman mo na. Okay? Another advantage of choosing a radial artery is that there is less chance of hematoma formation after the collection. Okay? So there is less risk also of accidentally puncturing a vein or damaging a nerve kasi walang malapit na nerve or vein sa ating radial artery unlike for the brachial and the femoral. Okay? So those are the advantages of choosing your radial over the other side of arterial puncture. Siyempre, lahat ng may advantage, meron ding disadvantage. So what's the disadvantage of choosing the radial artery? Okay? Over other side for arterial puncture. So performing radial arterial puncture requires considerable skill to puncture it successfully due to its small size. So yun lang, di ba? One selection criteria natin is of course, the larger the better. However, your radial artery is small in size. That's why it requires considerable skill. Okay, whenever we use this as our site for arterial puncture. Another disadvantage is that it's difficult to locate on patients with hypovolemia or low cardiac output. So minsan, hindi natin maiiwasan na makaka-encounter ka ng patient na may mga low cardiac output or that so-called hypovolemia. So struggle is real when performing arterial puncture, choosing your radial artery as the site of puncture. Okay? So, by the way, your radial artery is located on the thumb side of the wrist. So, just kindly look on your thumb and then palpate the artery, okay, na malapit sa wrist. At kung ano yung mapalpate nyo na nakikita nyo or nararamdaman rather na may pulse, that's your radial artery. Okay, yung kabila niyan, yun yung tinatawag mong ulnar artery. Okay, so it is easily accessible in most patients. So madalas, lalo na pag adult, they really have this radial artery. Okay, na madali mong makikita. So for your information lang, when it comes to your radial artery, the radial pulse can be felt on the thumb side of the wrist, approximately 1 inch above the wrist. Okay, crease. So, tulad ng sabi ko kanina, just look, okay, sa thumb ninyo, and then palpate doon malapit sa wrist crease, as I've mentioned, 1 inch above the wrist. And then you can palpate there and you can feel the pulse, okay, that your radial artery produces. Okay? So kung ano mang makapano dyan, iyon na po yun. Iyon na yung radial artery. Iyon na yung ginagamit for arterial puncture. Okay? So next site is the brachial artery. Siyempre, kung meron tayong first choice, meron din tayong second choice. Pero sa site lang class ha, pagdating sa lab, wala dapat second choice. Okay? So the brachial artery is considered as the second choice for arterial puncture. So if your radial is located on the thumb side of the wrist, your brachial artery is located in the medial anterior aspect of the antecubital fossa region, okay, near the attachment of the biceps muscle. So you already know what is this antecubital fossa region that we make use as our first choice in performing venipuncture. So alam nyo na, okay, where is the location of the cephalic, the median cubital, and the brachial, or rather the basilic vein. So, when you feel, okay, or you place the index and the middle finger near, okay, the basilic vein, at may nakapakang pulse or napalpate mo yung pulse, that's actually your brachial artery. So, try nyo na lang ulit i-feel tulad ng ginawa natin with the radial. So, pag may naramdaman na kayo na pulse or na-feel na pulse, iyon na po yung tinatawag nyo brachial artery. Okay? So, in here, again, just FYI, so the brachial pulse can be felt just above the bend, okay, of the elbow on the inside of the arm, okay, approximately in line with the ring finger. Okay? So, try nyo na lang yun. Again, can be felt just above the bend, okay, of the elbow. So, kindly try to bend your elbow on the inside of the arm approximately in line with the ring finger. Pero pagka nakapanyo naman na yung basilic vein ni patient, yung katabi nun na may pulse, that's actually your brachial artery. Kaya nga, di ba, third choice natin si basilic vein. Since it's near the brachial artery and at the same time, okay, there are nerves present on that side, so it's not commonly used. Okay? So the advantage of choosing this side over the other is that this is large and relatively easy to palpate and puncture. So based on experience, it's really easy to palpate for the brachial artery and to perform arterial puncture using the brachial artery rather than the radial. Okay? Pero syempre, iba-iba naman tayo, so it depends. Next advantage is that sometimes the preferred artery, okay, or this is the preferred artery for a large volume of blood, just in case you'll be needing large volume of blood, wherein rather you need to collect, okay, for example, 3 ml of arterial blood. Pagka kasi ABG, it's only 1 to 1.5 ml. But more than that, okay, it's best to use the brachial artery over the other side in performing arterial puncture. Okay, and then next there is adequate collateral circulation of your brachial artery, but not as good as the radial. Okay? How about the disadvantages of using this side over the other side? So this is deeper, okay, in location and can be harder to palpate than your radial artery. So medyo mahirap nga din. So itry nyong ipalpate yung radial artery nyo and your brachial artery for you to appreciate that information that it's harder, okay, to palpate for the brachial rather than the radial. It lies close to basilic vein, so there's a risk of mistakenly puncturing it. So instead of getting arterial blood, you'll be getting venous blood from the basilic vein. It lies close to the median nerve, so there should be risk or there could be risk of pain and nerve damage. So whenever we use or we choose a site for performing arterial puncture, we should always choose the site, okay, with less nerve present on it. Kasi nga, pag mas madaming nerve, mas masakit, so baka matamaan mo yun, magkaroon pa tayo ng tinatawag na nerve damage kay patient. Okay? And then last is that there's an increased risk of hematoma formation kasi there's no ligaments or bones to support compression unlike for your radial artery wherein medyo madaming bones present sa ating wrist, okay, that could support compression. Unlike for the brachial artery, wala masyadong bone, okay? Kaya that's one of the disadvantage of using that side over your radial artery. Okay? So this is a picture that shows you the arteries of the arm and the hand. Okay, so as you can see here, you have here the ulnar artery. Ayan. This is your pinky finger. Okay, whereas this is your thumb where your radial artery is present. So nandito lang siya, class. Okay, dito nyo kakapain. Okay? Dito nyo siya ipapalpate in that area. Okay? Pag may naramdaman na kayong pulse dyan sa area na yan, and in line with the thumb, that is your radial. But in line with the pinky finger, that's your ulnar. Take note that the ulnar artery cannot be used for arterial puncture. Okay? Whereas here, this is your elbow. Okay? So as you can observe, this is your axillary artery, and then this is your brachial. So if you feel a pulse, okay, here or near, of course, the basilic vein, therefore, that is what you call, okay, as your brachial artery. Okay? So whatever pulse ang mararamdaman or makakapa nyo dito sa site na to, sa may elbow or sa antecubital fossa, that's your brachial artery. Okay? Yan yung kinakapa natin pagka nag-blood pressure tayo or nag-BBP, yung artery na yan, yung ating brachial artery. Okay? So, next artery that we can use for arterial puncture is, of course, the femoral artery. Okay? So, this is considered as the largest artery used for arterial puncture. This is located superficially in groin, okay, lateral to the pubis bone. This is performed primarily by physicians and specially trained emergency room personnel, meaning not all site for arterial puncture can be performed by those who are trained in performing arterial puncture. Okay? Like for example, this femoral artery cannot be performed by your RT, by the medtech, level 2 phlebotomist, even though they have their training, okay, on performing arterial puncture. Puncturing the femoral artery is performed then again primarily by physician and specially trained emergency room personnel. Okay? So generally used only in emergency situations or when no other site is available for obtaining arterial blood and it's very needed for ABGA. Okay? Meaning this is the least site to use in performing your arterial puncture. Okay? So what are the advantage and the disadvantages of using this site over the other? So the advantage is that this is large and easily palpated and punctured. Okay. However, sometimes, okay, this is the only site where arterial sampling is possible kasi nga, okay, um, there are patients, okay, or in case patient suffering from hypovolemia or patient with low cardiac output or during cardiac resuscitation, there is no good flow of blood to your brachial and to your radial. So instead of using those sites, it's best to use this femoral artery in patients suffering from those conditions that I mentioned. Okay? For the disadvantages, femoral artery has poor collateral circulation. This lies close to femoral vein, so the risk of mistakenly puncturing that vein and obtaining venous blood rather than arterial blood. Increased risk of infection due to location of the femoral artery and the presence of pubic hair. Risk of dislodging plaque buildup from inner artery walls. And lastly, it requires extensive or rather extended monitoring for hematoma formation. Kasi nga, the location of the femoral artery is in the groin lateral to your pubis bone. So it's really hard to monitor, okay, if there's hematoma forming there. Okay, and of course, those other disadvantages, that's why we cannot consider your femoral artery as the first choice or commonly used, okay, in case of an adult patient. Pwede daw siya pag emergency cases lang or patient suffering from hypovolemia, cardiac resuscitation, and low cardiac output. Okay? So again, phlebotomist, okay, or you, if you become a phlebotomist someday, kasi here, kailangan muna nating mag-undergo ng training bago tayo maging phlebo. Unlike sa ibang bansa, okay, pag nag-take ka lang ng ilang units ng ganitong course, You can now become a phlebotomist in a hospital, so on and so forth. So what I want you to know here, speaking of phlebotomists, is that phlebotomist is not normally trained, then again, to perform arterial puncture, okay, at this location, specifically the femoral artery, okay, or to obtain some specimen or samples from cannulas, catheters, or other indwelling devices at these or any other locations. What are these other locations when performing arterial puncture? Ito yung sinabi ko kanina sa inyo, other site that we can use in case of infants and in case of adult wherein wala kang makitang radial, brachial, and femoral artery. And that is your scalp and umbilical artery in case of infants and your dorsalis pedis, okay, in case of adult. So on those sites, phlebotomists are not allowed to collect blood. Okay, kahit meron ka pang training or what, you're not allowed to collect blood or to perform arterial puncture on those sites. Okay, that I've mentioned. So this is the picture that shows you the arteries present, okay, sa ating legs. Okay, so we have here the femoral artery that is then again located, okay, in the groin, okay, lateral to the so-called pubis bone. Okay, so we have here also the popliteal artery, okay, the anterior tibial artery, the posterior tibial artery, and this is your so-called dorsalis pedis. Okay, yung malapit na sa toes or dun sa paa mo, present. So yung pag may nakapakang pulse dyan, na minsan naman talagang nakakapa natin, we call that artery as your dorsalis pedis. Okay? So those are the sites that we can use for arterial puncture. So what's commonly used for adult is your radial, brachial, and femoral. But the first choice and commonly used in adult patient is, of course, the radial artery. Second is the brachial. The least choice of performing arterial puncture on that site is your femoral artery. But then again, in case of adult, we have your dorsalis pedis as other site, or in case of infants, we have your scalp and umbilical artery to use, okay, as to collect blood for ABGA. So what are the disadvantages of arterial puncture and the reason why we perform arterial puncture? Though I've already mentioned this earlier during our introduction, okay? So the advantage or the disadvantage of arterial puncture includes it's technically difficult, as I've mentioned. It's potentially more painful and hazardous than veni puncture. Kaya nga instead of performing arterial puncture, what's commonly done in the laboratory is your venipuncture. Thus, it's not normally used for routine blood tests. Though tulad ng sabi ko kanina, okay, its composition is more consistent throughout the body. Okay, but still, specimen of choice will be the venous blood rather than your arterial blood. Okay, in routine blood testing. So what's the reason then again for arterial puncture? Primary and main reason is of course to obtain blood for arterial blood gas test or arterial blood gas analysis. So the arterial blood in case of ABGA is the best specimen to use for evaluating respiratory function. And at the same time, it has high oxygen content and consistency of composition is present in an arterial blood rather than your venous blood. That's why in case of ABGA, wherein we determine or we evaluate these parameters, okay, it's best to use arterial blood rather than your venous blood. Okay? So those are the things that we should consider, okay? Or those principles we should consider when performing arterial puncture. Okay? So after that, or after those discussion, of course, we'll now be proceeding on discussing, Okay, the main purpose or the main reason why we need to perform arterial puncture in the hospital. Okay, and of course, that is your ABG. Okay, arterial blood gas. So this is used in diagnosing and management of respiratory disorders such as, of course, lung diseases. So this ABG provide valuable information about the patient's oxygenation, ventilation, and of course, acid-base balance. Okay, so I'm pretty sure you've heard about this acid-base balance in other subject that you have now as of this sem or during the last sem. So this is used also in management, okay, of electrolytes and acid-base balance in patients with diabetes and other metabolic disorders. And also, specimens are sensitive to effects of pre-analytical errors. So take note that when performing arterial puncture for this purpose of ABG, okay, accurate patient assessment and proper specimen collection and handling are necessary to ensure accurate results later on. So specimen, okay, with ABG, since I've mentioned about the proper specimen collection. So in here, a specimen should not be exposed to air and specimen should be collected in an anaerobic manner. Kasi nga, when it comes to ABG, will be providing valuable information about the patient oxygenation. Kaya kailangan, pag nag-collect ka ng arterial blood, okay, by performing arterial puncture, there should be no exposure to air, for that air may contain oxygen, and if we collect that in aerobic manner, there is also presence of oxygen that could affect, okay, the result of the partial oxygen that we measure, okay, to have an information about the oxygenation of the patient. Okay?